Good evening, everyone. Welcome to this, which is the kind of the first in our new series of safeguarding e-themed webinars. So one of the kind of key planks of our wider safeguarding approach is the idea of having a local safeguarding plan. And the point of that document is really to build a bridge between the national policies, which contain lots of worthy statements about the environment that we're going to share and the sort of organisation we want to be and how we want to share all information with each other and with other organisations and all the rest of it. But in terms of how you run your group on a day-to-day basis are probably relatively hard work to engage with, because it's lots of kind of Woodcraft will do this. We will create an environment where so the local safeguarding plan is the place, and it is much like we say about a risk assessment. It is, the outcome is not so much that you have a piece of paper to hold in your hot little hand. It's kind of the minutes of the meeting. It's the record of the discussion and the agreement that you had, not just one of you going tick that box, but the conversation that you have with all the people that help to make that group work and make it a safe and supportive environment to volunteer in, and a safe and stimulating environment for young people. To go, this thing, we're committed to doing this. How are we going to do it within our group? So it is really building that bridge, and that's why it's an important part of the process. The other thing that it does is puts the key information for your volunteers ideally in a single place, so that if you do have an incident or you need to refer to what do we do in this situation, so you've got one place to look for. It should to some extent inform the risk assessments that you do for the activities and the venues that you use. We hope, we ask that you at least review it, even if you review it and go, yes, it's still fine, yes, it still makes sense, nothing's changed materially. But we do ask that you look at it at least annually. And also we'd suggest strongly that, if you have issues or complaints or near misses or incidents throughout the year, then you review as part of your kind of debrief from those, you look at and go, well, did the plan do everything? Was the problem that the plan wasn't followed, or was the problem that the plan was inadequate, or was it just something that came out of nowhere? And that's a good opportunity to update or tweak or tighten something. Like things like, if a child rocks up at group that you've never seen before, what you do about it. Or you can come up with an idea about how you'd respond to that, but actually you'll never really know whether that's a robust and realistic way to do it until it happens, for example. And the other thing is to say they are a shared responsibility. I'm assuming most people here are either local safeguarding leads or possibly group leaders. Is that right? Or group coordinators? Is that broadly correct?
About to be, yeah.
About to be. Wow, getting training before you take on a responsibility. It's a crazy idea. It might even catch on. That's fantastic. But I think, it's important to think that, not to fall into going, oh, the local safeguarding lead will think about that bit. As I say, even if the kind of the partnership between the local safeguarding lead and the group coordinator are the people who are really taking a lead on starting to pull it together, the responsibility for knowing what's in it, for putting that stuff into practice week in, week out, has to be shared, and therefore the knowledge and the understanding has to be shared among all the people that help to make your group work. That might realistically still just be a couple of you, or you might be one of these large and quite complex cooperatively led groups where it's a shifting cast of characters and you'll have any three from a wider group of about 15 leaders each week. Both models have strengths and weaknesses, but in those larger, more dispersed volunteer teams, you do have to think about how that communication and how that kind of following through of issues from week to week is going to work, and that's really worth doing. Okay. The document that we suggest that you keep and the template that we provide to support you to pull that together contains various different kind of issues to think about and consider. So there are sections that are around your volunteers, how you recruit them, how you screen them, but also how you train them up and then manage them on an ongoing basis. There are considerations about the behaviour of the young people and to an extent of the volunteers as well, and what you do to manage that and how you make it work. There's stuff around how to keep parents and young people informed so that they're all in a position to know what's going to happen, to be ready to engage with the group positively so that you don't generate lots of complaints because people don't know what's going on, but also so that they can do their part in keeping the group a safe and positive place to be. There is inevitably some stuff in there about data and about consent and making sure that you've got a robust process to make sure that you're not taking and sharing photos and videos of people who either would prefer not to, or in some cases there's a really significant safeguarding or child protection reason why that shouldn't be done. There is a bit about how you will deal with disclosures, incidents and complaints if you receive those. And then there are some sort of additional things to think about, some of which will be relevant to every group and some of which will be more situational. So, venues, the nature of the venue that you use, how you manage coming and going from it, transport, if that's a thing that you do, food, if that's a thing that you do at your groups, and provision for first aid and so forth. So those are that's the shape of the document. And in each of those cases, it's about considering what the policy requirement is, in some senses, what we're legally obliged to do, and then there's a few prompts of things you might want to think about, and then there's a space for you to go, right, what are we doing in our group, and who's responsible for making sure it happens. So that's the front page of the document, and the idea with the template, and this is the one that I'll share the link on when we publish the webinar. But if you go to the resources section of the website, it's there. If you go to the resource drive, it's there. The idea is that as a local group, you would populate the bits in yellow with your local information. So we suggest that at the outset you have, on that front page, the key information about emergency contacts, effectively. Who is your local safeguarding lead? Who is the health and safety lead, if that's a different person for your group? It doesn't have to be. Who are the local social services, social care contacts that you would deal with? Now, in most cases, you will be dealing with a single point of contact, a single borough. I appreciate particularly in London, but also in some kind of more rural areas, you might find that you've got young people attending the group who are spread across a number of different local authority areas, in which case you may need to record, you may need to think about, well, yes, we're meeting in Ealing, but we've got kids who come to the group from Hammersmith, we've got kids who come to the group from Hounslow or wherever it happens to be. I know one London group who I think are now up to 6 boroughs that they draw children from in their venturer group, which does present additional problems. And just a word on that. I mean, we've used the broad terminology of Safeguarding Children's Board. Increasingly, you will find that things are referred to as safeguarding partnerships, or you will find a MASH, particularly in London, which is a multi-agency support hub or similar. Everywhere uses slightly different terminology, but the key contact that you would ring if you had a concern about a child or a young person in your care would be the one to populate that with, as opposed to the local authority designated officer. So they are the people who deal with concerns about predominantly adults in the children's workforce. So if you had an allegation made against a volunteer, then that's when you would contact your local authority designated officer. That, Gareth, I'm afraid, is the English terminology. There will be ever so slightly different arrangements in Scotland, although the basic elements stay the same. I would also always include on that the NSPCC helpline. They are a very good resource if you've got a kind of nagging doubt and you're not sure whether it's significant, what to do with it, and so on. You can always contact that helpline, and either they will give you an answer there and then, or if it's something a little more complicated, they will refer it to a second line practitioner who will be trained in children's social care or whatever, who will come back to you with a response, which will enable you to take the right action. I recently had one which was a Scottish query, and they had to go off and they had to find a social worker who was specifically knowledgeable about how things work with different legislation and legal frameworks in Scotland, and they came back and they gave really helpful advice, which enabled us to take exactly the right step. So I would recommend that. You can always contact that service anonymously as well. They won't take your details if you don't want to give them. If you just want to pose them hypotheticals, they are very good at dealing with those. Okay, so yeah, as I say, populate the yellow bits. That's the idea. The white bits are the bits that refer to our policies and procedures, and we'd ask you not to alter those. It's not the only shape that the document can take, but this is the easiest way to make sure that it contains everything it needs to. So to look into the body of the document, you will have a category, an area of activity. We will tell you what the policy is, in brief terms. There will be a link through to the actual document or policy or procedure that deals with that thing, and I've now got hyperlinked web links at the end so that you can find the right document if you need to go into it in a little bit more detail. So second column is what you have to do. The middle column are things that you might want to think about. They won't always be relevant. Some of those will be specific to groups in certain situations or groups that work with a particular age group. And then the yellow bit, the agreed practice, that's the decision that you come to about how we are going to manage that thing. For example, there needs to be a named local safeguarding lead. Is that going to be the same person as the health and safety lead, or are you going to have one for the whole district, or are you going to have one for each group? Are you going to nominate someone who's going to be at all or most sessions, or are you going to nominate someone who's at a little bit more of arm's length, who can be called in if necessary? All of those are valid, but it's for you to record what you're going to do. And then I would urge you to put a name against it or a role against it, so that you know who's responsible for making sure that thing happens, particularly if you are in one of those sort of larger groups with a shifting cast of leaders helping out on a rota basis, to know who the person is who's responsible for checking the first aid kit on a monthly basis, or making sure that volunteer inductions are signed off, or whatever. It's really helpful to have a name against that. Less important if it's just you and Steve, and it's always going to be you or Steve in that column. But if it's a kind of much broader group of people, that level of accountability is really helpful. So yeah, hopefully the document is fairly self-explanatory. Hopefully it is fairly easy to find the policies and procedures that you need to go to get more detail. And it's merely a case of going through that document and ensuring that you've populated the bits and had the discussion and made the decision and recorded the outcome. I suppose the other thing to say about the safeguarding plan is that it works. There was a time when we had lots and lots of different bits and pieces of documentation, and there were safeguarding plans, and there were safeguarding checklists, and there were summaries of basic expectations and things like that. We've really tried to reduce the amount of times that we're saying mostly similar things in slightly different formats, and strip back the guidance, because it was just piling up. The things that we expected you to know and be familiar with and have regularly updated and kept to hand before you started running groups for children, was beginning to get ridiculous. So we've tried to strip it back so that you can distill everything that you need to know and share and agree into essentially 3 documents. It's not to say that you never need to read the safeguarding policy or you never need to look at the record keeping advice, but the kind of, as long as the leadership of the group, your key office holders are vaguely familiar with those things. If you've had the discussion about what you're going to do to put policy into practice and recorded that in a local safeguarding plan, if you've had a discussion about the possible things that could go wrong and how you're going to mitigate them and put those in a risk assessment that's specific to your venue and to the range of activities you do, and then finally, if you do the first aid needs assessment, this is a new thing that we have only just started to provide guidance about, and we will be dropping some more guidance with safeguarding leads very shortly to help with this one. We've had a variety of bits of guidance about first aid and what you should do and what you need to do and what you could do if you wanted to. And we've tried to strip it back and make it much more simple. You do not absolutely need to have a first aider at every session. You need to have gone through a process and you need to have agreed what is appropriate to the needs and to the risks that are inherent in your provision. So it is sufficient for a group night with a relatively small number of children in a urban area where help is relatively close at hand, and you're doing a low risk range of activities, to have an appointed person who takes charge of a first aid kit and can step in and provide some emergency first aid if required. That is sufficient if you've gone through that process and gone, is this enough? If you are doing, a 10-day expedition halfway up the side of the Cairngorms with, lots of roped and, ice climbs and so on and so forth, you might need to ramp up what you're doing. So it's a case of having the conversation about what is necessary, what is sufficient, what is needed to meet the expected need. And so as long as you've done those 3 things, that's the majority of the things that you need to have in place to work with your group. So just wanted to focus on a kind of almost frequently asked questions around the safeguarding plan. Often people will say, well, do we need one for each group, or is it all right for us to have one for all of us? And I think that's very much a decision that you need to take locally, depending how much you differ. Are you a large and spready district working with lots of different people in different corners of the borough in different venues, in which case you will probably need something that's specific to age groups or something that is specific to venues, in the same way as you'd have a risk assessment that was specific to your venue. If you've got, an Elfin and a Pioneer group that meet back to back in the same hall on the same night with predominantly the same group of leaders coxing and boxing between the 2 of you, one plan is probably fine. So there's a decision to be made amongst yourselves about whether you're all the groups in your district, if you are part of a district, are working enough of the same ways. Sometimes you have one group in one corner of the borough that's very leader led, and one group that's very much a kind of much more of a kind of rota collective, all hands on deck kind of a thing. And actually, that's when you want probably safeguarding plans that reflected that difference, and so it might not be appropriate to have one plan covering everything. As I said earlier, talking about who owns each thing that you talk about, who is responsible for making sure it actually happens. That might be names or it might be a role. Is it the group coordinator? Is it your local membership secretary? It's always worth just kind of stepping back from it and going, oh, it's, what we've said is great, but what else do we need to put it in practice and make sure that people have got access to that? Whether that's about training, whether that's about physically, you will say if there is a disclosure or a concern, you should fill in a form. Is that form there available? Do people know where to find it? For example, you will talk about your first aid needs. Is there a first aid kit? Is it regularly stocked up? Do we check it regularly to make sure that the stuff isn't out of date, for example? And then also whether the volunteers can just pick that up and run with it, or whether they want or need additional training or support to make it work. So that might mean, we need to send somebody on a first aid training course. It might also mean we just need to make sure that we have a, monthly or termly planning session at which we provide a space for people to raise concerns or ask queries or questions. So those are the things that you should be thinking. Once you've got got the document, got the template populated, what else needs to be put into place to make it work, both physically and more holistically. Thank you all very much, and I'll hopefully see you soon.